Just a quick picture to show you what we're dealing with. That's the Borrelia burgdorferi, and it was one of the early pictures. The work of Alan Steer, who was one of the early pioneers in discovery, not too good in the treatment, but certainly in the discovery. It has a predilection for these systems: articular, vascular, muscular, and the nervous tissue. They can penetrate almost any tissue, and they can reside for months or years, both extracellularly as well as intracellularly. The wall, or the cerebral endothelial wall of arterioles and capillaries of the brain, are penetrated by these organisms. And the myelin, or the myelin sheath of the peripheral nerves, are very subject to inflammatory activity by these organisms. Synovial cells of joints, fibrocytes of muscles, T and B cells, as well as macrophages of the immune system. We're not dealing with a friendly organism. The blood-brain barrier is something that it is able to cross, and it has a lot of escape mechanisms. First, it can survive within the cell itself, safe from immune detection. So the organism escapes the immune system of the host and persists during the later stages of the disease. And it can persist. It can exist within even your very immune cells. And it can evade. It can evade immune detection by changing its coat. It's like it has a yellow coat and then it changes into a blue coat once it enters into the mammalian system. And it is evasive of the immune system. And it can camouflage itself by penetrating your own immune T and B cells. And it goes into a cyst phase where it can remain dormant for many years without causing you any problem, but under stress it can revert to its spiral form. And there's a picture of the spirochete with what we call spherical bodies, and they are thought to be regenerative new organisms, or at least they stimulate the immune system as if it was a new organism. And that was the new generation of spirochetes. I'm going to go past that, and I'm going to go past molecular mimicry. Now, if Lyme wasn't enough, 4 different species we found, our friend the tick can carry 5 different organisms and then really give you 5 different diseases all at the same time. It can give you Babesia, which is a red cell parasite. It can give you Ehrlichia, which is a white cell parasite. It's a rickettsial organism. It can give you mycoplasma, and we believe there may be a viral component now to the tick's gastrointestinal tract. For certain, there is in Eastern Europe. All right. This sounds pretty grim, but it really isn't grim, because I think that it's an issue of information. It's an issue of understanding what the biological dynamic is, and then moving forward in a logical, persistent, ongoing treatment program for the individual. And it takes in many levels. It isn't just antibiotic therapy, but sometimes you have to treat the depression, you have to treat the sleep disorder, you have to treat the immune deficiency, you have to use nutraceuticals like coenzyme Q10 and magnesium, because magnesium appears to be deficient. Some people argue that it's the other way around, but magnesium seems to help many. You need to use nutrients like B12, you need to use alpha-lipoic acid, you need to use some of the newer thinking, cemento, which is cat's claw, Some high forms of colloidal silver and colloidal gold have been very instrumental in helping certain people. So there is, and some of the new work shows that in the more advanced neurological cases, intravenous gamma globulin can be very useful and can turn some cases that would appear to be intractable around so that that person is leading a vital and active life. Because the subject really is so vast, I just wanted to sketch this little bit of pre-discussion for you, and then I think now I'll just open the house up for questions, if that's okay with the moderator.
How about the myths?
Well, the myths, why don't somebody ask me some myths? We can turn the lights on as well. Yes?
Could you speak about the history of the vaccine related to Lyme disease?
The vaccine's been a real problem, and it was originally brought forward by one of the pharmaceutical companies, and SmithKline Beecham. But unfortunately, the vaccine, never took into account the co-infections, but worse, there were people that were genetically predisposed to the particular protein that the vaccine was made from. And when the vaccine was given, they developed serious autoimmune disorders, disabled them completely, and they were unable to work or do anything like that. So there was a major lawsuit, and it was taken off the market. I don't know now what the state of the vaccine development is, frankly. But certainly a long time coming.
Dr. Raxlen?
Yes.
We have a list of questions, but people have asked that you come up and speak so that they can hear you. Would that be okay with you?
Come up in the front? Sure. Would you like me to go through the myths?
Yeah.
Okay. If you don't remember being bitten by a deer tick, you don't have Lyme. That's self-evident, right? Most of the patients that come to me swear they never had a tick bite. They don't remember a rash. They don't remember having the early stages of Lyme. So that's a myth. You don't have to be bitten by, remember being bitten by a deer tick to have Lyme. You can only catch Lyme disease in Lyme, Connecticut. That's true. A negative Lyme test means you do not have Lyme disease. Now that really is a major problem in the field. As I pointed out, there's a number of problems with the testing. Most of the testing is done by LabCorp or Quest, some of the hospital labs. And unfortunately, the test kits used date back to the late 70s. And the two-tier system has been proven to be really very inconsistent. And the reporting, what you would call a test, positive, goes through so many variations that to make a diagnosis of no Lyme from a negative test is doing serious injustice to the patient. Even the CDC says it's a clinical diagnosis based on the history and the symptoms of the patient. Only the test helps confirm the diagnosis. Never walk away from your own intuitive awareness something is dreadfully wrong or something is seriously wrong from Lyme disease on the basis of a negative test, particularly in the two major labs. There are labs like neuroscience